Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm joined by Dr. Ellen Sharenow, and we're here to talk about the psychological impacts of a mastectomy. First question for you, what are some of the questions that a woman should ask before having their mastectomy?
Well, they should ask the doctor everything that they think they need to ask, which includes what is the procedure going to be like, what is the time that it will take to recover, what kind of side effects could I expect, what kind of pain, how long will it take me to go back to work. Any and every question that someone can think of would be the right question to ask.
How does a mastectomy change a woman's image of herself?
That's a really good question. So, how a mastectomy changes a woman's self-image really depends on how important her breast is to her in terms of her self-concept, her sense of self. In general, women who are of childbearing age, younger women, tend to have greater feeling or their self-esteem is wrapped up more in their breasts than someone who is much older or, as we say, postmenopausal. So in a very general sense, women who lose a breast at a younger age have a much harder time coping emotionally with the loss of that breast than women who are older, who are past childbearing age.
Are there any normal feelings a woman has had when she has her mastectomy?
I think the biggest one is just the loss of a body part, the loss of a sense of who you are and how you see yourself, how you identify yourself. There can also be a sense of loss in you may have to dress differently. So your look and how you identified yourself to the world may also change depending on what you do after your mastectomy, whether you have reconstruction or not.
In addition to the physical differences, are there emotional or psychological differences between having a single mastectomy and having a double mastectomy?
We're noting that a lot of younger women now who need a mastectomy are also opting to have the other breast removed as well, even though there's no cancer there, for a lot of emotional reasons, one of which is that they're afraid that the cancer may recur in the other breast. Also, too, they don't want to go through the whole process of cancer treatment again. And so I think for those women, having a bilateral mastectomy actually makes them feel better about their cancer. Now, in terms of how they feel about their body image, I think that really depends on, again, how they feel about their breasts and whether they're going to have reconstruction or not.
I've read that some women who choose not to have a reconstruction feel empowered by that decision. Is that common?
Whatever a woman chooses to do, whether it is reconstruction or no reconstruction, that if she feels good about that decision, she will feel empowered by it. But there are women younger women who are choosing more and more to have no reconstruction. So it's not uncommon.
What are some of the services and support that you provide here at UMass Memorial for breast cancer patients?
So we run a monthly cancer support group where everyone with any kind of cancer is welcome to come. That's run by our social worker. We also have someone from the American Cancer Society who is a patient navigator, and she meets with patients individually. She provides free wigs, services through the American Cancer Society, and then I'm available to see patients for individual therapy regarding the emotional aspects of dealing with mastectomy and the treatments.